The POWs were fortunate to have a doctor among them, Dr. Chikao Hori, who would later become chief pathologist in the U.S. at Harvard University. However, after Hori rejoined his family in Slocan in April 1943, Angler was left with only one inexperienced medical officer and unsatisfactory facilities. Tanaka complained that in the event of a real emergency, a patient would die waiting for all the red tape and approvals required to get a POW transferred to a real hospital. The men also complained about inadequate diets for those with stomach troubles, indigestion, gastritis, and ulcers.
They are fed nothing but eggs 3 times a day, and they're tired of eating eggs day after day. Nobody wants to eat eggs every day.
The men also complained about the lack of proper dental treatment, with a number suffering from severe toothaches and tooth decay, and some only having their false teeth partially repaired. Tanaka even advocated for one of the POWs who had testicular TB. Caught in the early stages, Tanaka requested that the patient be sent to a suitable hospital and undergo an operation at the earliest opportunity. On October 2, 1944, 2.5 months after an operation at Port Arthur Military Hospital, 47-year-old Masanao Shirakawa's condition worsened, and he died. The reported cause of death was peritonitis. During his last days, Tokikazu Tanaka stayed by Shirakawa's bedside, took strict care of him, and wrote down his last will and testament. Reverend Mitsubayashi conducted the funeral service in the recreation hall, and 10 of the POWs were allowed to attend his funeral outside the prison fence. Robert Okazaki wrote that it was the first funeral in the camp, and that all the POWs felt a deep, empty, melancholy sense of loss. Masanao Shirakawa was laid to rest southeast of the camp, on the east side of a little hill.